All right, so the first test we're gonna do the Tinel sign. Basically, it's also known as the Hoffman-Tinel sign or nerve percussion test. And the structures that are tested for this, it's usually your median, your radial, your ulnar pathology. But just for a test purpose and talking to Jen, she just said just do the median nerve. And that's what we're gonna do. Positive findings, just tingling or pain with tapping on the nerve. Proper position, my patient could be standing or seated. In this case, she's gonna be seated. And then proper stabilization, just supporting the hand when being tested, basically. Stress point is just my index finger or middle finger used to percuss over the carpal tunnel. Movement is gonna be just me basically percussing, tapping on that median nerve right in here. And then compensations, just making sure that patient isn't like contracting or having her hand very too loose or so, but just want her to be relaxed. Yeah, that's what I meant to say, not contracted, want her to be relaxed. Okay, so this is the this is the not injured side. So just go ahead and relax for me, Isis. Yep, and then we're just gonna percuss right in here. Anything?
No.
Nope. And then we'll do it on the other side. Making sure just that. Anything?
No.
Nope. And that is the Tinel sign. All right, so next test we're gonna do is called the Phalanx test, also known as the wrist flexion test. And basically the structures tested is just gonna be the carpal tunnel syndrome, presence of carpal tunnel syndrome. Positive findings are just gonna be numbness or tingling in the thumb or index finger or middle finger. Proper stabilization is just either facing the patient or being at the side of the patient. There is no stabilization hand because this is inactive, and there is no resistance hand because this is inactive. Movement for this is just patient's gonna bring her arm up, drop her elbows, and go into this position. Compensations to look out for, patient not slouching, postures up correctly, making sure elbows are dropped. Yep. All right, so go ahead. All right, and then slowly drop your elbows, there you go. Another one, just making sure don't bring your arm in. All right, hold that for a couple minutes, or seconds. And any pain?
No.
Nope. And that's Phalanx. All right, next we are going to do is going to be valgus of the third PIP. So we have your DIP, we have your PIP, and we have your MCP. So it's going to be the third one of this one. All right. Alternative name is also known as either the varus or the valgus, but we're doing the valgus today. And basically, we're just testing the integrity of the medial ulnar collateral ligaments of the MCP and PIP joints. Positive findings, pain or laxity or both on the ulnar medial ligaments compared to the uninjured side. Patient's gonna be seated with elbow flexed. Stabilization is just gonna be stabilizing the more proximal aspect of the joint being tested, and resistant hand is just gonna be grasping the distal segment of the joint being tested. And then movement is just me applying a valgus force onto that joint. Compensation to watch out for is just making sure that patient is not contracting, making that finger like really stiff, making sure she's fully relaxed and I can apply those motions. All right, so we're gonna do the uninjured. Since she's wearing a ring, we wanna make sure that comes off. Thank you. So stabilize, and then we're gonna apply that valgus force onto the PIP. Any pain?
No.
Nope. All right, and the next one. And relax. Any pain?
No.
Nope. All right, all good. All right, so next we're gonna do Murphy's. There is no alternative name. What this structure, this test is looking out for, is tested for is the lunate. And then positive finding is like if the knuckle is in line in the carpals, with the carpals or with the other knuckles. If this knuckle, the most prominent one, is in line with the rest, then it's the carpals are starting to move in there and can cause wrist pain. Patient can be seated or standing. In this case, my patient's gonna be seated. There is no stabilization because it's an active test. There is no resistance because it's an active test. Movement, patient just makes a fist, and we're looking out for that prominent MCP knuckle, basically. Compensations for this is just, patient not fully making a proper fist or so. So kind of like going out here. Yeah. All right, Isis, for the non-injured side, just go ahead and make a fist for me. All right. And we see the prominent knuckle. Good, and it's not in line. Was there any pain with that at all?
No.
Okay, and this side? All right, I see in line, not in line, sorry. Prominent, sticking out. Any pain with that at all? Nope. Okay. All right, next we're going to do the flexor tendon avulsion test, also known as Jersey finger sign. Basically, we're just going to be testing the integrity of the flexor digitorum longus tendon. And positive finding is that the digits with the longest flexor tendon avulsion does not fully flex into the palm, basically. Clinician's positioning, I'm just going to be by her side. I can be in front, basically anywhere, because this test is really an active test. So, stabilization, none. Resistance, none. Compensation, patient makes a fist, basically. And then compensation is just to look out for, it's just like, patient not fully making a fist, maybe trying to go like this instead or so, but we really want patient to make a fist like this. All right, like I said, something to look out for is like basically this. If this happens, that's a positive finding. So go ahead and make a full fist for me, Isis. There you go. But this time, see what she did there? But this time, let's try to like fully, yeah, there you go. And that one with so that was an uninjured, this is injured. All right, perfect. All right, final test is gonna be Froment, hopefully I said it correctly. Alternative names, none. Structures tested is gonna be the ulnar nerve and adductor pollicis. Positive finding, if they can't flex and adduct and hold it, which is the paper, so they need to hold it by, flexing it, by flexing the IP joint and flexor pollicis. That would be a positive finding. So they have to like flexor pollicis longus, it will be a positive finding. Clinician positioning, I would be in front or by the side of the patient. Basically, stabilization hand, there's none, and resistance is just me pulling the paper out of her hand. And then basically the movement of this is just bringing the thumb into flexion and adduction while holding the paper. Some compensations or so, or like, making sure they're not using two fingers back there, making sure it's just one. So those are little things to look out for. So go ahead, Isis, put that in your finger. There you go. And make sure she wants to flex that thumb in. All right. And then I'm just gonna pull, and don't let me pull out, okay? All right, do that for like about 5 seconds. Good, relax. And then now do the injured side. All right. And good, relax.